guys hear me? Hey. So the session after lunch is always the toughest session because I always say big lunch equals big nap. But hopefully we won't bore you. Yeah, but obviously I think you know my name, Ray Serrano. People call me Dr. Ray Serrano. I feel like it makes me really old. But then I realize I am really old. But I thank you for coming out today. This is a great time to have discussions about a lot of things. For me, healthcare is probably the most important issue for me. And the reason why I say this is my logic and how I understand things. I always think of health being the basic form of human dignity. If you don't have your health, it disenables a lot of stuff in your life. And to enable that aspect to restore human dignity, healthcare is a need, right? You need to have healthcare to restore human dignity. So the fight for healthcare, healthcare access, is really a fight to restore human dignity. I say that from a very personal level. I always give the story of my mom and like, mom. I grew up in Idaho, migrant farm worker family. Hence, sorry. Oh, sorry. Oh, thanks for interrupting. So migrant farm worker family, single parent mom, worked 2 jobs, 16-hour days. Every single morning she would wake up. You would see her at 4:30 in the morning to be at work at 6 o'clock in the morning, to come back at 2, shower, go back to the next job at 3 to 11 p.m. every single day. By the time my mom got in her late 50s, it was just a lot of issues: diabetes, congestive heart failure, total knee replacement, just a lot of issues that came. And one of the things I want to say is that, like, my mother was a product of very good genes. Her grandmother lived up to 102. My grandmother, my mother's mother, lived up to 109. My great-grandmother and my grandmother were born in a rancho in Mexico, a little village in Mexico with no running water and no electricity. Mom was born in Weslaco, Texas. Largely grew up here. Mom died at 73. 35-year difference. So it defies the logic that somebody would grow up in the United States, would die 35 years less than somebody who lived in the rancho with no running water, no electricity. How does that happen? So then you start asking these deeper questions. Where are we? What do we know of what works? When we talk about chronic disease, there's infectious disease, so you get bitten by a mosquito, you get COVID, and there's a chronic disease that's long-lasting. That is, I sometimes say chronic disease is the disease of the powerless. Because if you had power to choose where to live, you wouldn't get asthma. If you had power to eat certain foods, you might not get diabetes. But here we are. Our population, your generation, your life expectancy might even be lower than your parents, which is crazy, right? With all the technology and all the medicines, you would think we would be living longer than our parents, but not necessarily the case. So for this session, I'll shut up and I'll turn it over to the experts, and really do have 2 amazing people today. Does anybody know who here has a family member or has diabetes? Raise your hand. Parent, sister, brother. It's big in our community. Our community, Latino, African American, is, I used to say, but my mom was one of 12. I think one aunt doesn't have diabetes. We used to say it was a rite of passage. It was like going to college. You don't really become an adult until you get diabetes. That's how crazy it was. The American Diabetes Association is a very powerful, very great organization that educates, empowers, advocates, does a lot. We have the CEO of the American Diabetes Association, Mr. Chuck Henderson, and I'm going to turn it over to him. But before that, I'll also mention Ms. Toni Newman. The National Minority AIDS Council is a very powerful network that addresses the issue of HIV. And we don't normally think of HIV being a chronic disease, but now there's so many medications that people can live positively with HIV. And we also don't think of HIV being a Latino disease, but it really is. It's affecting our population more than we can ever imagine. And so we'll eventually have Ms. Toni Newman join us on the stage with Ms. Catherine Ferguson, who's Vice President for Federal Advocacy. But before that, I want to have a few remarks by Mr. Chuck Henderson. He's a former basketball player. Texas A&M. He lives in Dallas. He'll tell you this whole story, but he's an amazing person and just an inspiring person. And the work that they're doing in the American Diabetes Association, I can't stress it enough. It is absolutely powerful. So thank you. Please give a round of applause for Mr. Chuck Henderson.
Ray, thank you so much. You're going to be a hard act to follow. But good afternoon, everyone. Just in full transparency, I know you guys are running a little bit behind time. So my good friend Catherine Ferguson told me to stick to my talking points because she knows I get off track. But extremely, extremely excited to be here and really to see a lot of young people here because you guys are the future of our next leaders and our next generation. So, you should all give yourselves a round of applause for being here. Again, it's a true honor to be with you all today at the League of United Latin American Citizens National Convention. And in preparing for this meeting, I was super, super excited. I was born and raised in Texas. And so, what was equally exciting to me is since LULAC was founded in my home state of Texas in 1929. And so, that rings well with me. Texas, there are a lot of folks. Everybody says, everybody goes big in Texas. But, pleased to, be partnering with an organization that was founded in Texas. And so when I think about the impressive history for nearly a century, you guys, your organization, LULAC, has been laser focused on your mission to advance the economic condition, educational attainment, political influence, housing, health, and civil rights of the Hispanic population of the United States and Puerto Rico. And so when I think about the organization that I represent, there are a lot of synergies, a lot of commonalities. Being the American Diabetes Association, we also have a strong history. This year marks our 85th year of being an organization. And so when I think about both of the constituencies, what we do, we serve the fight, the impact of diabetes and obesity. And so when I think about, to Ray's point, these two diseases carry with them a tremendous burden, impacting millions and damaging the health of generations of families, especially families that look like you in this room and look like me. When you think about the fastest growing chronic diseases in the world and in the United States, they're diabetes and obesity. We have to come together to do something about that. We were founded, again, 85 years ago in 1940, and our mission, again, is to prevent and treat and possibly find a cure for diabetes and all those that are affected by diabetes. And, a lot of, the ADA has done a lot of things around driving research, around driving advocacy, advocating for people that can't advocate for themselves, and programmatic activities in communities, meeting people where they are. We have to serve our constituents. And so I just want to share a few of those achievements. The ADA, we're the largest operator of camps for children with diabetes in the world. We have 3,200 campers every year at our camps. These camps provide a safe space in which children with diabetes can meet others with diabetes, often forming lifelong friendships, learn disease management, and skills to thrive. Also, we'll kind of go off script for a minute. We have an employee that has worked in our camps for many, many years. She credits growing up in the ADA's camp because at one point when she first got diagnosed with type 1 diabetes, she didn't really understand the disease. She got depressed and she thought about taking her life as a 9-year-old. And so she went to our camps, to find like-minded kids or kids that were dealing with similar issues. And so she actually credits our ADA camps for saving her life. And so when I think about many other stories like that, our camps are good for kids that are newly diagnosed with diabetes. We've also launched programs aimed at bending the curve on diabetes, such as our Project Power initiative, which offers families a free lifestyle change programs. And so just a little bit about Project Power. Project Power, we also have Project Power for adults and children to reduce the risk for diabetes or live healthier lives with type 2 diabetes because it's environmental, right? Type 2 diabetes is something that you can prevent or something that you can improve upon with the right diet, with the right exercise, with the right education, with the right tools. And again, it's about education and the tools, meeting people where they are, and meeting people in the communities where they are. And also, one of the great things that I love about the ADA, we're all about research. The ADA was founded on research. And so we publish the leading scientific journals, including what we call Diabetes Care, and annually publish our standards of care, which I think is the gold standard for all things diabetes. It's about a 600-page manuscript that researchers, physicians, clinicians, diabetes educators, they use that, as a way of educating and then putting those tools into practice about recommendations and advancements for care. We also convene the largest annual scientific sessions in the world. We just had it a couple months ago, similar to your conference. It's a big conference. We attract over 13,000 scientists, researchers, physicians, and healthcare professionals from around the globe. And so when I think about, I'm always, thinking about tenure, about time, about how long we've been around. And so when I think about since 1952, the ADA has funded research with a strategy of fostering the next generation of investigators in research to create better treatments and improve health outcomes and research aimed at finding a cure for diabetes. And I do think that we're really, really close to finding some form of a cure for type 1 diabetes. And to date, the ADA, since its inception, has nearly funded $1 billion in a game-changing research. That's a big, big deal in terms of finding some sort of a cure. And so when I think about, and you'll hear the brilliant Catherine Ferguson that's on our team come up on stage, when I think about our advocacy efforts, advocating for people that can't advocate for themselves, we've achieved major milestones. And when I think about driving policy to make medication and diabetes technology more accessible and affordable, including capping the cost of life-saving insulin in state health-regulated healthcare plans in 28 states, including the District of Columbia. Also, Medicare or below $35 a month from an insulin cap standpoint. We've also opened access to life-changing continuous glucose monitors, or what I refer to as CGMs, that you can wear to kind of track your glucose levels, and that helps you, give you immediate feedback in terms of what you put into your body and how that reacts to it. It also helps our seniors, our veterans, our military veterans, improve coverage for Medicaid recipients in 30-plus states. And so we also launched the Amputation Prevention Alliance program. And so one of the things is 1 in 4 people of color go into a doctor's office for diabetes-related complications around amputations, and we come out of there with 1 limb or multiple limbs less. And when you look at what our counterparts, our non-people of color, they come out just fine because for whatever reason, the doctors say, well, these individuals of color are coming from under-resourced communities, aren't gonna take better care of themselves, so we're just gonna cut a limb off, right? That is not right. And so we launch programs to address these issues, bring these issues to the forefront from a policy perspective, because it disproportionately impacts And in 2024, we launched Obesity Association because we want to change the narrative in the future for those impacted by obesity and chronic diseases. So when I think about stats, right? I know, Ray, you're big in stats. And so when I think about 40+% of US adults live with obesity, and the intersection of diabetes and obesity is undeniable. Another startling percentage, when I think about 85% of people living with diabetes living with type 2 diabetes and also have obesity or overweight. And the impact of that is staggering, with obesity linked for over 200 chronic conditions. And so when you think about where diabetes and obesity plays in the chronic disease, every other disease, it works around diabetes and obesity. So when I think about heart, when I think about liver, when I think about all the other chronic disease symptoms, it also, that source is because the individual 9 times out of 10 will have type 2 diabetes or be diagnosed as living with overweight. And so again, we're launching programmatic programs in the community to address these issues. And so again, when I talk about these milestones, it's not to brag. I mean, these are facts. This is the truth. And so it's more than just history, but they are a launch pad to actually do what's right. And that's about the foundation that comes up next. And so again, a little bit about me. I've had the honor of serving as the CEO of the American Diabetes Association for 3.5 years. Like Ray said, grew up in Texas, went to Texas A&M, was a former collegiate athlete. But again, when I think about what my role is now, I want to leave a legacy of doing good. You know, have a great family, have a great daughter, but, you know, I'll tell you, as I'll talk to Catherine, I get this question is, you know, why did you, start transitioning your career in a nonprofit? Because I wanted to do good by people. I wanted to do something, that would last a lifetime. And so when I think about, being excited about the direction of where we're headed as an association, and my North Star is to have a world ultimately free of diabetes and obesity. And so then I want to talk about, is very important, similar to LULAC, and your great leader, your fearless leader, you have to have a strategic plan. You have to execute on that strategic plan. So when I think about what our strategic plan is our plan is aimed at rising to meet the challenges of our mission and is guided by 4 pillars. It's research, it's advocacy, it's education, and connection. And all 4 of those pillars include a focus on diabetes prevention and management, health access, nutrition, wellness, obesity, and primary and collaborative care. And again, our focus on diabetes and obesity prevention and management is foundational to everything we do at the ADA. Our goal is for health access is to be the voice of the people in resource-limited communities disproportionately impacted by diabetes and obesity by tailoring outreach, improving access to education and resources, fostering trust, and addressing barriers to care. And I also, want to bring up, because there are, a mix of young people in the room. I would encourage you to really think about, when you think about where you're going to school, when you think about what you're going to major in, I would encourage all of you to consider a career in healthcare. We need more people that look like us in the rooms to gain trust. Full stop, right? I know Catherine's probably, I hope Chuck doesn't say the wrong thing. That can be recorded. But at the end of the day, right, I'm as transparent as they come. We need more people in the healthcare profession, because I know that you all go to the doctors and get checkups. A lot of times the doctors don't look like us, right? And so do we trust what they say all the time? Absolutely not, right? Because we want somebody that looks like us in those rooms, and you have an opportunity to do that. And then back to obesity. It is absolutely an epidemic. When you think about more than 2 in 5 U.S. adults living with this disease. Earlier, I mentioned the undeniable connection between type 2 diabetes and obesity. Obesity accounts for up to 53% of new cases of type 2 diabetes every single year. And so, in recognition of this, the ADA announced the formation of the Obesity Association, which is a division of the ADA. And so this announcement, it really marked the first step in our laser focus on changing the conversation around obesity and the need to remove the stigma and shame that is often associated with it, along with recognizing and treating obesity as a chronic disease as it is. And so many of you, who aren't healthcare experts, obesity just became a disease or named a disease 10 years ago, right? Which is a problem. Right? And so now it's known as a disease, and so it's getting it's getting more attention now, and it should have gotten a lot of attention many, many years ago. And so since that time, we've also launched the initial chapters of our standards of care in overweight and obesity that discuss how healthcare professionals can address weight stigma and bias with their patients. And so, I also want to touch upon another thing that the ADA is focused on, and that's primary and collaborative care. So why is the ADA focused on those things? When I think about this, we know that 80% of people living with diabetes receive their care from a primary care practitioner and team, because it takes 6 months to a year to get in to see an endocrinologist. So we need to educate the primary care people, because that's the first point of contact. And so our partnerships with primary care associations, practices, and professionals ensure that people who treat our constituencies have the guidelines and the tools they need to deliver the best up-to-date evidence-based care. And so back to LULAC, enough about the ADA. And so I know that LULAC has a strong advocacy focus. You advocate on people that can't advocate for themselves, which is powerful, and that's why the ADA is pleased to be working with a great LULAC organization. Because advocacy is one of the ADA strategic pillars, and frankly, this is more important as we face an environment where America's safety net programs, prevention programs, and research are facing devastating funding cuts. When you think about SNAP benefits, when you think about Medicaid benefits, when you think about a lot of the healthcare agencies that are potentially being impacted, again, we need to work together. We appreciate your partnership to defend against these actions in the most influential ways possible, which is, I'm a team player through and through. We need to work together as a team. And so ADA's advocacy team, working in partnership with many other like-minded organizations, have been hard at work to call on these policymakers to protect funding for healthcare programs such as Medicaid, such as food assistance, programs again like SNAP, and the research and prevention programs that are essential to advancing the ADA's mission. And so again, in my opening statement, I mentioned we have common enemies, and those enemies are diabetes and obesity. Diabetes and obesity are among the most expensive chronic diseases in the nation, and leading causes of disabling and life-threatening complications and unfortunately death. And so again, obesity is linked to over 200 conditions, and diabetes can affect almost every part of our bodies. Again, I'm always going to talk about this: our brains, our heart, our skin, our kidneys, livers, nerves, and our ears. It is a leading cause of amputation of lower extremities, new cases of blindness among adults, kidney failure, cardiovascular disease, and stroke, just to name a few. And so again, in the coming year, our country will face challenges, and we're currently facing challenges, ensuring people that are at risk for diabetes and obesity have access to care that they need to stay healthy. And so again, you may ask, what comes next? Well, it depends on all of us in this room and our external partners. We gotta be willing to show up, we gotta be willing to speak out, and we have to be willing to do the work and go into our communities, because everybody is relying on us to do what's right. I know it's a scary time, but at the end of the day, it's not like we've gone through these challenges before, throughout the history of the United States. And so every effort, big or small, is important and it matters. But what I want to leave to you is I always want to leave a call to action. And so we're facing a chronic disease health crisis of epic proportions. The time for incremental change is over. We must act boldly, urgently, and absolutely together. The question is not if this crisis will continue to devastate families. It already is. The question is will you join me and the American Diabetes Association in this fight? Will you stand together to ensure that future generations aren't burdened by this preventable disease? And it is paramount that we come together across communities, across cultures, across sectors to bring our collective strength to this battle. Again, let's rise together and change the course of history. And thank you for allowing me to be here today and to participate in your national convention. I really look forward to our organizations working more closely together from a sense of urgency, with hope, with an unshakable belief that together we can end diabetes and decrease the prevalence of obesity. And so, best wishes, and I wish you the best for your conference. Thank you so much.
Thank you, Mr. Henderson. Yeah, a lot of information packed in. I think, again, when we talk about disease, I always say humanize the story. There's a lot of facts, a lot of stats. Humanize the story. Think about what you're talking, like who you're talking about. Like the other day, there was a reporter that called the office from Telemundo, and it says que queremos saber más de la ley grande y hermosa. I thought to myself, what is that? Ley grande y hermosa. And I'm like, I guess, yeah, when you translate that one big, beautiful bill, that's what it translates to. But I'm like, how stupid does that sound? How stupid does that sound? How awful does that sound? Because when you look at the details of that law and how it restricts healthcare access for immigration status for so many people, and how that weaponizes, like, if you don't show your papers, you could be denied access to an emergency room. You could be denied access to a clinic. Like, my sister's an OBGYN. Like, she was an OB gynecologist. She works in El Paso. And just the countless stories of women there who have not gone for prenatal care. When we filed the birthright citizenship lawsuit, we called people in the Rio Grande Valley to find out. So the condition was we wanted to find our Linda Brown, right? We wanted to find the plaintiff that we were going to sue on behalf of. We had to find an undocumented family, an undocumented woman who's going to give birth after February 19th. So we had a list of folks that were kind of interested. There were migrants who had crossed over the border who expressed some interest that maybe they might be willing to be a part of this lawsuit. So we called, and we had ladies in the office call. One after another, they had not even gone for prenatal care. They were 7 months pregnant. They had not even gone one day. So that's just to give you a clue of how serious this stuff is. These policies matter at the local level. It really determines whether you get access to see a doctor, whether you get access to see a nurse, whether you die 20 years younger than you're supposed to. Again, so I can't stress that enough. But anyway, I'll shut up again. I want to introduce Ms. Catherine Ferguson and Ms. Tony Newman, if I can call them up to the stage. There you go. They are both fountains of a lot of experience. Catherine, I think, is from Montana. There you go. So from Montana, which is neighboring Idaho. And then Tony is from out here. So I wanted to introduce, Catherine is vice president for federal advocacy with the American Diabetes Association, has a wealth over probably your entire ages, 20 years of experience in policy and advocacy at federal and state levels for this disease. Obviously, like me, a lot of this stuff is very near and dear to us. There's a reason why we chose this profession. Tony has done everything. the National Minority AIDS Coalition, she is the director of the Coalition for Justice and Equality across movements. Herding the cats, bringing all of us together. Every 2 weeks we have meetings. I'm so used to seeing Tony on a Zoom session. I never actually see her in person, so to see her in person, it's such a delight. So I will just have you guys open it up and just have you guys tell a little bit about your story, but a little bit more on the issue. I guess I'm going to go back to my initial point. If chronic disease is a disease of the powerless, then how do we empower those? How do we go upstream? it's very easy to tell people. I remember they used to tell my mom, okay, Maria, you need to eat kale. My mom was like, "Yes, kale." What's it? She didn't know what kale was. Like, it's just funny to think about because I think that's so downstream. That's so at that point where you're trying to get somebody to do something, but how did we even get here, right? And that's the deeper questions that I ask. So I'm going to open it up for you to kind of make introductions and just kind of answer the question of how do we go upstream in our thinking and our approach.
Hello? Oh, testing, testing. Thank you so much, Ray.
Yeah.
Well, honestly, I think it starts with young people. Right? It starts with all of you. It starts with all of you being here and willing to engage and be active and learn. Go to school, get an education, represent yourselves in your community. And for those of us in our organizations that are working really hard on these issues, we need faces, right? We need people to join us. We can't tell stories without people. And so we need all of you to have enough courage to stand up and tell a story if it's your family member or yourself or a loved one, and to be willing to respond and join all of us in our collective work. Because without that and without young people joining these causes, they don't go anywhere, right? So that commitment, that urgency, that understanding, that activism is what's really, really important. Every voice matters, even and especially in times when we feel like they don't, they do. And with that collective voice, like, we really can make a difference, so.
Well said. At the National Minority AIDS Council, I run a justice center with over 100 orgs, which LULAC is a part of. The young lady today said, faith over fear. We are in a tumultuous time now, and I'm advocating for Asians, Black, Latins, all minorities in America who are discriminated against. We have to stand together. We have to come together as a group, as a race, regardless of race, sex, and gender, because Project 2025, they are executing it perfectly. We're using the law to try to stop them. But what we have to do, I think unity is the key here. HIV is a chronic disease. We are the National Minority AIDS Council, which we do work with others who have diabetes and high blood pressure. But we have to come together collectively. You have to put aside your biases of other nationalities, other races, other genders, because they have the money and the power. And if we don't come together, we're going to lose this fight. You have to come together as a unit, both Latin and Black, Asian and Indians. I'm working across the board. My whole theme of my life is collaboration. I came from the bottom, went to law school to fight for justice, and we won. We're losing a lot in the Supreme Court, but we are winning. So we have to come together and make sure that we are unified and put all of your biases aside, because until we do that, chronic disease will continue in the minority community because we're poorer, we have the less money, we don't have health care access, and unless we come together and vote these people who work for the people out of these jobs, we're going to continue to be in the situation we're in today.
Thank you. Thank you. No, I think I tend to be a little bit weird. So, kind of a pessimist. Like, we hear what you should do, right? Eat healthy, eat your peas, walk 10 miles, whatever. Important stuff. It is important. But but there were also, I don't think we take sufficient accountability of what doesn't work. There's things that we've been told for so long that supposedly would work and just didn't. Can you find anything that you can trace in your careers of like in diabetes or HIV that were told to us as kind of lessons that we should be taking upon ourselves that just did not work? And what have we learned from those failures?
That's a great question. For me, in the healthcare access, when I was living in poverty, it was having the doctor understand my needs. There was some type of communication with my white doctor. Now I have a minority doctor, but at that time I had a white doctor, and they just didn't get me and what my healthcare needs was as an African American. That I found to be a barrier, and now how we're trying to change that is working with the American Medical Association to get more Black and Latin doctors. There are 3,200 Black and Latin doctors in medical school now. So hopefully you will see someone that look like you when you go to the doctor. Because I found when I saw my Black female doctor, she understood me a lot better. When I'm talking about thyroids that my mother had, blood pressure my father had, diabetes that my grandmother had her, she had some issues, almost got her foot cut off. There was just a lack of understanding of our community. Of course, we eat fried chicken, lots of sweets. We are not the healthiest group of people in America. We do eat very poorly compared to our white counterparts. But I think communication and having someone that looked like was a barrier for me. But now having a Black doctor, I'm getting pretty good health care. And that was a barrier for me. Catherine?
Yeah, I agree that we do have to incorporate everyone in order to have particular.
Catherine, and I like my white doctor. I don't want you to think I didn't.
Oh, it's all good.
I don't want Catherine to think I didn't like my white
Oh,
doctor.
it's all good.
I just caught myself, and I like Catherine a lot, so I don't want to think like, she didn't like the white doctor? I did like the white doctor.
I like women doctors, so anyway. I know, I get it. No, I think you're right, though. We have to be inclusive, right? In order for healthcare and education and resources, people need to feel safe. They need to feel like they're in a trusted environment. When you go to, if you're able to seek medical care, you need to be able to feel like you're in a safe environment. So it starts with that safety. And I think as, activist organizations that we all are and fighting for rights for people and access, we are working really hard to ensure that we do have those access to services and programs, right? So a lot of the work that we've been doing with LULAC is about Medicaid, right? We know that Medicaid serves people with diabetes almost a fourth. 24% of people on Medicaid have diabetes. And so critical access to those continued services for people is really, really important. And we're, fighting for that very closely.
I just want to say one thing. Latin women are 4 times higher to get HIV than white women. Latin men are 3 times higher. We have to change that. Whites are using PrEP. Black and Latins are not using PrEP. Why is that? Why are we not on PrEP if you're sexually active? So those are some of the questions I think we should ask ourselves about HIV as a chronic disease. It is preventable. I've worked for 2 white men who've had it for over 30 years. They look fabulous. You would never know they had HIV, but Blacks and Latins are dying quicker than my white counterparts. So we have to figure out why that is.
And I think that's across different diseases, right? Just in terms of access to medication and technology that we know works and helps, right? So we've been fighting for insulin and access to insulin and making it affordable for people. We've been fighting for technology to make sure people can manage their diabetes, because we know in communities of color, there's a lot of stats and research out there that there's less access, and that's frankly, that's unforgivable, right? We need to all have access to the things that work.
Yeah. So, fun fact about me, before I did my PhD in health economics, I was working in Africa. I worked in Africa for 3 years with the UN Development Program, and I worked there as an HIV specialist. And so that was kind of my first thing. I was really interested and fascinated in the world of HIV. That was I was fascinated by the idea that you have a medical disease and you have a social disease. It seems to find itself in the populations where society really misses its mark. Women, minorities, LGBT. So I was fascinated by this disease, but now I work a lot in obesity. I work a lot in diabetes, and I find the language. You would never think obesity and AIDS would be kind of very similar as diseases, but the language seems very similar when you talk about them. How did you get it? Surely you must have done something wrong. You were lazy, you were sleeping around, you were doing this. And so the folks that have it don't want to actually get treatment because they're so stigmatized to even get treatment. They don't even want to acknowledge. And I think that's one of the lessons that we've learned. For the longest time for HIV, we used to scare people. If you get AIDS, you will die. The idea of living positively just did not exist. The idea of getting diabetes, no, si comes esto, if you eat this, you're going to die, you're going to die of diabetes. No, you can live positively with diabetes. You can also prevent it. Like the idea of my family saying that it's a rite of passage to get diabetes. No, it's not. No, it's not. But I think that's some of the stuff that we've learned the hard way of doing that. I was going to ask, I know we're running short on time. Are we shorting? Oh, 3 minutes. Okay, I'm getting it. I'm going to ask for last closing remarks, but I'm going to ask for one thing. I'm going to throw this out there because I think it's an important issue. I don't know if it's been talked about before, but misinformation. You all have an uncle or an aunt, and mira lo que miré en el YouTube. Look what I saw on YouTube, and they send it to you, right? And they accept it as fact. No, yo miré esto en el YouTube. I saw this on the YouTube, on the internet. And we're like, no, bro, like it's not, it's not real. We are sponges for misinformation. Latinos, Spanish language radio, you listen to it sometimes, and que no se preocupen, que Trump solamente va a deportar a los criminales. I'm like, que don't get worried, Trump is only going to deport the criminals. Yeah, clearly the criminals are gardeners and children with cancer, and yeah, really, like, so we know that's, but there's so much misinformation, so much disinformation that's being thrown at Latino communities. How do we set the record straight? How can we use our organizations to set the record straight, to fill that void of misinformation with actual real information from trusted people?
Well, as HIV, I would say go to nmac.org. Since we are the largest HIV org in the country, that is our specialty. We have experts on staff to talk about PrEP, and we work with all the pharmaceutical companies. If you're going to find out about whatever you want to find out, go to an expert. Don't read Google. That someone puts on an article and says, if you eat an apple every day, you'll never get diabetes. I saw that one time. That's crazy. Go to a doctor. Don't believe everything you read on social media. Go to an expert. If you need the law, go to see a lawyer. If you need medical advice, go see a doctor. So I would say if you wanted more information about PrEP, about HIV, nmac.org. I'm Tony Newman at tnewman@nmac.org. I'm open to you emailing me. I will forward it. If you have a legal question, I'll give it to my legal team. If you have an HIV question, I'll give it to the treatment team, which is comprised mostly of Puerto Ricans and Mexicans who are on that team, and they're bilingual. So we can help you if you have questions pertaining to HIV, and I'll give it to Catherine.
Thank you. Yeah, I think it's also working together, right? ADA also has a lot of resources that are available on our website, ada.org, around diabetes and obesity, but we have to work together to, echo each other and to have, with information that's coming from trusted sources, right? Do go and look and reach out to Ray, reach out to ADA, reach out to NMAC, and don't just accept, the sort of the first thing you see, and how can we sort of build that community together of trust and information is really important.